So we're here today to talk about the Radiance Ayurveda and Cosmetology Clinic and to answer some basic questions that are commonly asked about the Radiance. Here with us is Dr. Basima Nahan, the founder and chief physician at the Radiance. So let's start with one of the most basic questions. What is Radiance and why did you come up with the name Radiance?
So Radiance means radiate from within. Okay. So it's an integration of Ayurveda and cosmetology. Initially, when I started working, I'm an Ayurvedic doctor with a fellowship in medical cosmetology. So initially, when I started working, I've been working with Ayurvedic doctors and dermatologists. Wherein, when we are working in two different clinics, it's two different systems that is followed, and we see simultaneously the results that is obtained in both the systems. So then I came with the fact that it will be good if you integrate both. Also, I will get a very satisfactory result from the patient because Ayurveda focuses more on the internal humors. It talks about the daily regimes, the seasonal regimes that you should follow. It's more of a lifestyle, what you should eat, what you should not eat, the combination that you should follow. And it gives you more of an internal equilibrium, internal peace. On the other hand, cosmetology focuses majorly on the external. External as in the appearance, the skin texture, hair, aesthetics and etc. So anything, any disequilibrium or any concern that you have related to your skin, hair, nails, anything definitely has a little bit to do with your internal humors. So we have to. So when we integrate both, we look into everything. Even if a patient comes with a single concern, we look into all the attributes of their health. That is their digestion, their menstrual cycle, acidity, sleep pattern, and which together gives a very good result. So that's how Radiance came into being, and yeah.
So when you have such an integrated approach, when a client walks in, how is it managed? Like, is there a separate consultation for Ayurveda, separate one for cosmetology? How does it work?
So we have one consultation. We have a case sheet that is kept together for Ayurveda as well as cosmetology. Wherein, even if, as I mentioned, even if a patient walks in, for example, acne concern or pigmentation, we ask them from the root. We ask them about their sleep, their digestion, their body temperature, everything. So, and at that point, even the patient realizes that they have had some other concerns as well, which definitely goes hand in hand, and we explain it to them how it goes hand in hand. And most of the time, when we clear the internal humors as well as give them an external skincare routine or a daily routine, it gives a better result. It's not just that, it's all about, it's not just about treating one cause specifically. It's all about the diet, supplements, lifestyle, skin routine, hair, if it is hair routine, everything. So we give them an integrated 360-degree approach which they have to follow, and definitely there will be treatment wherein if we feel that they are going to benefit more from Ayurvedic treatment like Talabodachil, etc., then we give them that. If, for example, if it comes to hair, we feel they are going to benefit more from PRP, PRF, etc., then we go for that as well. So,
it depends entirely on the client's needs.
It depends entirely on the patient's concern as well as the doctor's protocol decision that is taken. So it's again, I told you, it's not one protocol for all. Every patient is different. For example, if you take it in Ayurveda, it's called as Prakriti. There are three doshas, that is Vata, Pitta, Kapha, three humors in life. Every person is different. Every person has different identities and issues and concerns of their own. So after looking into all that, we decide a protocol that that will be followed for them.
Also, when you have such a different approach and such a unique combination of Ayurveda and cosmetology, what are the feedbacks and opinions that you've gotten from all your patients?
I'm actually quite happy with the feedback that we've got till now, touch wood. So most of the time, a patient who walks in goes back being as a part of our family or a friend, because between the consultation, we also talk about if there is anything that is disturbing them. Because, even if it is skin or hair, if your stress levels are higher, no matter what treatments you do, it's not going to give you the 100% result. So we talk to them about if anything is concerning them, if how their food habits are. A lot of girls who come with PCOS issues or acne issues also suffer from a lot of eating disorders. So all that has to be corrected. So at the end of the day, they are very happy, as in we feel very connected to each and every patient of ours, and it's not like a corporate approach or a hospital approach. It's more of like a one big family. So I think that gives everyone a good peace of mind, and happiness at the end of the day, even when it comes to treatment and everything.
Okay, so that's all the questions that I had in mind. If you have any more questions about the Radiance, please comment below.
Thank you.